For 20 years, we've committed to helping the people of the Cayman Islands live longer, healthier, and happier lives. But healthcare and the expectations of patients are rapidly evolving, and so must we. We have made incredible clinical and technological advancements and achieved JCI accreditation, the internationally recognized gold seal of approval for patient safety and quality of care. So it's time for our image to reflect our transformation from a local hospital to a world-class healthcare authority with a new logo that symbolizes national duty and pride, a statement that reinforces our commitment to our patients every step of the way, with colors as bold as our mission to provide the highest quality healthcare. Dynamic, professional, skilled, committed, caring. This is HSA.
We're here with the lovely speech and language therapy team at the Health Services Authority. I'm so pleased to see this team expand. I remember when it was a one-woman band. It has definitely expanded, and this is fabulous. All Caymanian female professionals, which makes my heart even a little bit extra warm today. So let's go ahead and do some introductions. We'll start over on my right. Good morning.
Good morning, Sandra. How are you?
I'm good. So tell us your name and what your position is here at the HSA, and just a little snippet about yourself.
Yes. So my name is Raven Ramon. I am one of the lovely speech therapists here at HSA. So I have a master's in speech and language therapy from the University of Essex in England. And I also have a bachelor's of science in psychology from Georgia State University in Atlanta. I've been a practicing speech therapist for 6 years now. Can't believe it's been that long. And I'm a born and raised Caymanian. Many of you might know my parents. I'm not going to name. I'm going to just let you look and see. But born and raised, and you know, like you, I share the same sentiment. I am just so thrilled to be a part of this team. And we are just killing it and doing our best to serve our Caymanian people in our, locals and all here in Cayman.
Yes.
So in terms of specialty areas, I do specialize in feeding therapy. So I do offer that service here at HSA, and more specifically the SOS approach to feeding, which is a world renowned program. And we've been doing really well in terms of, assisting families in supporting their children with picky eating and also with problem feeding. So, yeah.
I may have to talk to you later. All right, so we've got next.
Hello, good morning. My name is Janelle Sims. I'm one of the junior speech and language therapists here at HSA. I graduated with my master's in speech therapy from the University of Essex in England earlier this year. And I also have a bachelor's of arts in primary education, early childhood and education. I've been practicing for just under a year, and my focus here is kind of a bit of everything. I feel like we all kind of have a bit of all of the different areas. So I do early intervention, work with autism spectrum, phonological awareness, that sort of thing. And I'm really excited to be part of the team. It's been such a great experience so far. And I'm looking forward to continue serving our Caymanian people.
Okay, beautiful. Thank you so much. And of course,
my name
hello.
Hello, and good morning to your wonderful audience.
Yes.
My name is Faith Roches. People might know me as Faith Geely.
Yes.
Same, one and the same. I'm just married now. I have been a practicing speech therapist for 16 years.
Wow.
So yes,
That went by quickly.
It really did. I have a bachelor's and master's in communication sciences and disorders from the Florida State University. Go Seminoles. And I am currently the team lead for speech and occupational therapies here at HSA, in addition to my clinical role. I am a generalist clinician, so I do see birth through end of life, but currently with the makeup of the team, I am serving primarily doing adolescents to adults. And so I am dealing with strokes, dementia, dysphasia, which is swallowing disorders, traumatic brain injury, as well as all of the adolescent concerns, so like language, dysfluency or stuttering, everything you name it, I do it.
Yes.
So I am also a founding member of the Caribbean Speech Hearing Association, Caribsha, and so I do a lot of volunteer work regionally as well. So a lot of people know me in the speech therapy world across the Caribbean as well as in Florida.
Okay, wonderful. Thank you so much. Hi.
Hello, good morning. My name is Mariah Freeman. I am one of the junior speech language therapists here at HSA. I was born here in Grand Cayman, and I was raised in the BRAC. I have my bachelor's of science degree in communication disorders from the University of Arkansas, and I have my master's of arts degree in speech pathology from Louisiana Tech University. I've been practicing as a speech language therapist for just over 2 years. Primarily, I've been working with children, with a focus in children with children on the autism spectrum. And so right now I kind of have my caseload.
It's a bit diverse.
So, I'm working with kids with language delays. We're working on, language goals, communication goals, that sort of thing.
Yeah, awesome. Well, it's so amazing. Thank you, ladies, for that introduction. It's just amazing to see how much the program has grown, and that as a result of that, you can kind of start to focus on specialty areas and offer a wide range of services to people across the community. So I think that that's absolutely phenomenal. But when people hear the term speech and language therapy, I think we all in our head kind of have an idea of what that is. But then sometimes there are things that fall in the spectrum of that we don't really think about. Like you were talking about feeding therapy, and I hadn't even thought of that, to be honest. So can you give us a comprehensive definition of what speech and language therapy is all about?
Yeah, so you're right. A lot of people kind of have like a misconception of what we do or what speech therapy is. And so basically speech and language therapy, as speech and language therapists, we assess and we treat a range of communication, eating, feeding, swallowing disorders, as well as fluency. And I think Faith and Raven are going to go into depth a bit more about like those different areas, but it's just supporting from birth to end of life with communication, language, and feeding difficulties.
Yes, because I hadn't really thought about it until Faith just mentioned it, but we kind of think a speech and language therapist is needed sort of at the early stages in life to get you going, and then you figure, oh well, I've mastered it, I've got it. But there's things that might happen, strokes, dementia, just things, life happens that you might need additional support services. So yes, we can talk a little bit more about.
So for adult services, a lot of times for adults, it's something acquired. So I've had a brain injury. Typically, it's something neurological. So I may have had a brain injury, even sometimes with COVID. Like we'll see some post-COVID vocal cord paralysis. Some people post-COVID are having some type of it appears like neurological, even though it may not show up as that, but word finding issues, memory issues, those sort of things. So anything related to do with any swallowing or communication difficulties that you're having that's been acquired. So maybe I didn't used to have this issue, now I'm having it. I work with a lot of teachers, for example. A lot of them may use their voice a lot, and they're losing their voice as we get older. Our hormones change. So at HSA, we really take a holistic view as to the whole patient. So a lot of times when I'm sitting with my patients and they'll say, hey, I'm going to ask you some personal questions, but I'm trying to get a whole picture. So we don't just look at just the symptoms or a doctor's diagnosis and just give you a cookie cutter approach. We really try to look at the whole person, and we say, well, have you checked your hormones? Have you thought about this? Have you thought that maybe your voice is changing because of your thyroid? We really go into it with the patients, and we also really value providing culturally responsive care. And it's not just because we're all Caymanians that we know how to provide, but I think all of us made a very intentional effort to educate ourselves on how to be culturally responsive clinicians, because unfortunately speech therapy is a field that 90+% of the field looks a certain way and has a certain
So
cultural
what does that
background.
term mean when you say culturally responsive?
So culturally responsive care
Yes.
is taking into account the unique factors of your cultural heritage, your religious background. Maybe you have a blended family, maybe you have multiple languages. So I think a lot of times clinicians think, well, yeah, I respect everybody, but it's more than that. It's understanding that, hey, in this culture, your parenting dynamic may look like this. And so how do we support the goals that we're working on in a way that is respectful and honors who you are as a, like, from a cultural standpoint.
Right.
And so it's not judgmenting. We're not judgmental. We're not judging people to say,
Yes.
oh, well, you're doing this wrong as a parent. No, we realize that, hey, in your culture, this might be how you discipline your children. In your culture, this may be how you model things for children. Let's show you a different way that still honors who you are. And even like for my adults, you know, like if they are very religious, I might say, hey, let's practice reading scripture because that is something that's important to you. And so we're doing things that are like, look at your quality of life, look at who you are as a person, and really honoring that to make sure that we're giving you the best quality life across the lifespan.
Wow, that's super interesting. Thank you for that. So what sort of conditions or disorders do you tend to treat in children versus adults? Do you see similarities in the two groups?
So like Faith said, mostly in adults, it's an acquired situation.
Yes.
So for children now, we're definitely starting from the beginning. And we see from the beginning, from birth, we're looking at feeding, looking at the ability to suck and swallow, looking at any issues going on there with that. And then right as the baby starts to grow into infancy, into toddler, we're looking at then communication and feeding as well. So we start from just typical language disorders, looking at the ability for the child to understand what is spoken to them, and then the ability for the child to speak as well. So that's the language part of it. And then we look at things like, you know, neurodevelopmental disorders, things like autism that are more, you know, we kind of see them as a child grows, we tend to see different signs of that. And then we're also looking at school age things, fluency, articulation, which is speech sound disorders. So it is a plethora of things that we cover in terms of just the development of children. And we honestly have that down in terms of, you know, really, like Faith said, taking that holistic approach to the child, the parent, the home, and really picking apart and saying, okay, how can we best support you in terms of the goals and what's going on for your child at this point in time?
Yes.
Yeah.
And let me just ask you a question about children in particular, like when it comes to babies. I mean, nobody gets like a precise manual when you have a child and what to look for and what to do. So how are most of those types of issues identified? Are you finding that it's the parents that are able to pick up on it, or is it through, you know, taking the baby in for like a welfare check, that physicians are then making referrals to say, hey, you might want to have this checked. Let me refer you to a speech therapist?
Yeah, so we're seeing a mixture. Actually, we have some parents who are, you know, tuned in from the very beginning and are able to pick up on these signs. And then sometimes we have where the child will go for a wellness check and the doctor will, you know, pick up a red flag. Or even the teachers, right? Sometimes we have teachers who are saying things in school and that becomes a concern, and then we can kind of dig a bit deeper as to what is going on there. Yeah.
Right.
We do have a small percentage, though, of children who maybe were premature or may have been born with like a genetic disorder. So we now, because our team has grown and our capabilities have expanded, we're now keeping track of those kids, you know, and just making sure we're almost doing preventative care with them, like just doing sort of regular visits to make sure that they're developing okay. So we have kids that have different syndromes, hearing loss, those types of things that we're just doing check-ins like every 3 to 6 months. Let's see how you're doing. Let's see how you're doing, you know. And we don't believe in over therapizing children. Not everything needs to be addressed therapeutically. You know, if your child is a bad speller, that doesn't necessarily mean they need speech therapy. You know, it might just mean that they're a bad speller or they need more practice at home. But we certainly want to expand even more and go more into that preventative stuff, not only for children, but even for our adults as well. And so we're hoping that as our team continues to grow, we'll be able to offer more community-based services for our adults, for our aging population. We see a lot of dementia here, you know, and it would be, I see for my patients where they've caught dementia early, and I'm doing cognitive input with them, and I'm monitoring their diets. We're able to kind of prevent things like aspiration pneumonia, and we're able to kind of delay the progression of the disease. And so I see with my patients where, you know, we've been working for like 3 and 4 years, and they're still like can have a conversation, but you can see the declines, but it's not as rapid as like, whereas I meet a patient and they're already in the moderate to severe stages, and then it's very little I can do at that point outside of just giving like good family support and caregiver training to make sure that they know what to look for, and they have strategies to cope with that. So yeah.
Wow. So it sounds like even for the adult patient, the younger patient, it's always early detection being so incredibly significant. Yeah. Wonderful. All right. And what are some of the, you know, sort of more common things that you see for both children and adults? And is there any particular area that you could put your finger on to say that that's a growing area of concern for either group?
Well, in terms of children, definitely the specialty area that I spoke about earlier. We're definitely seeing an influx of children with feeding disorders, with picky eating, and families just having a hard time figuring out how to navigate that, because it is quite a stressful type of, you know, issue, and it's also an issue that impacts every area of the child's life, right? And it impacts the parents significantly as well. So, like I said, we're providing services from the spectrum of just picky eating, simple picky eating, straight to, like Faith mentioned, we have children born with different things that, you know, we need to address early on to help with their oral motor skills, to help with their sensory differences. So taking, again, that very holistic approach and looking at feeding, but it's definitely something that we're seeing great numbers lately, and we're so thrilled to be able to offer the support. We're always getting, you know, additional trainings, and able to then meet the families where they're at in their journey with feeding. So
Right.
Yeah. For adults, I would say I've definitely seen an increase in like Parkinson's disease. So before the end of the year, I hope to be certified in the Lee Silverman protocol for Parkinson's disease. I think we've always had a certain number of strokes and dementia. I do see patterns within families that at this point, in like, because I've been at HSA for so long, that at this point I'm kind of like, when I see certain surnames or know that there's certain family connections, it makes me wonder if there's like genetic predispositions that maybe we just aren't aware of, because that's something that I think I would love to see HSA get to, where we're doing more research. I think we're so busy trying to provide great care that we're not doing as much research that I think we could be doing. But, and then with strokes, I wouldn't say I'm seeing an increase in strokes. I think what is different now is that in the past we used to send a lot of our strokes overseas. And I think because of increased ability to provide rehabilitation services on island, what we're seeing is that, you know, a lot of times we would get people back after they've been sent away for a while, and they would be in a different phase of their recovery. We're sort of more in that consolidation period. With strokes, you typically, that first 6 to 12 months is that golden period. And so typically they would be sent away to get that intensive, and then we would see them kind of on the tail end when things were starting to plateau. Whereas now we're seeing them from the ward. And so there's very few patients now that we are sending overseas. So I think that dynamic is just different, but it's not that it's more. I think it's just that we're now able to manage. But even things like autism, I remember when I first came home, we used to have to send kids overseas to get an autism diagnosis. Now we're able to assess, provide treatment, really good rehab, and really good rehabilitation on island. You know, it's very rare now that we're having to send kids overseas. So I think that just speaks about how much services have grown and developed to meet the needs of the island.
No, that's awesome, to be honest, because we know the difficulties of being able to afford to go overseas and to find time to go overseas, and
Yep.
you know, especially if you're a parent dealing with a child that might have special needs, trying to integrate that into sort of your normal routine as much as possible is so important. So that's fantastic to hear that more of those services are available locally. What's the difference between dysphasia, is that the correct pronunciation, therapy, and feeding therapy?
So with dysphagia, it's typically an issue with the swallowing kind of mechanisms, right? Sometimes with feeding, we do have that as well. And we typically tend to label children with feeding disorders as feeding therapy as opposed to dysphagia. But with feeding, we are looking at sensory issues as well. We're looking at environmental issues. We're looking at just starting out from the womb, learning how to feed, right? Being able to coordinate the suck, the breathe, the swallow, all of that, right? So that's the main difference with feeding. And then with children, we're also really working with the families to be able to, you know, provide support for them to support their child, right? Because therapy is just a snapshot. The child comes in for 45 minutes to an hour, right? But I have to be able to equip the parents then to go home and do the same things. And like Faith said, also looking at what's culturally appropriate for them as well, right? So looking at the foods that they eat, the times that they eat, you know, all of that. So that's from a feeding perspective. Faith, do you want to say any more on dysphagia?
Sure.
Yeah.
So dysphagia typically is a result of some type of injury to the pharynx, to the nerves in the throat or the tongue, or sometimes it's a result of a neurological issue like a stroke. And so with that, the swallowing mechanism is compromised. And the worst case scenario with dysphagia is that if I eat, things are going into my lungs. And like I tell my patients, you know, your lungs were not made to like synthesize Cayman style beef and rice and beans.
Yes.
So with dysphagia, what we look at is first of all, what is the potential for rehab if we're able to do exercises? I am trained in several approaches to that are evidence-based to deal with dysphagia. The McNeil Dysphagia Therapy Protocol, which is really great for patients like post-cancer, because that radiation, there's a lot of scar tissue, those it's a hard time to get things moving, and so it's a really intense swallowing program that helps particularly patients who are post-cancer, post-radiation, to help them get back to an oral diet. Then there's also things like Vital Stem, which is using neuromuscular electrical stimulation, which I think most people would know it like as almost like a TENS, but it's specialized for the throat, because a normal TENS unit would definitely burn the muscles of your throat. So I don't want anybody to like go get a TENS machine from the pharmacy and start, you know, shocking themselves. But I am trained in Vital Stem as well. And that just helps to stimulate those muscles, like if you've had a stroke, trying to really just help stimulate those muscles, because the nerves are not responding to that feedback from the brain anymore. So we want to see what we can do to stimulate. And a lot of times we'll just use compensatory strategies, you know, modifying diets, that sort of thing. And again, this is where that culturally responsive care comes in, because, you know, then you can sit and say, hey, this is where you use your fish dinner, but don't use no bones. And then that blends really nicely. And so we're able to kind of help tailor diets and work with the nutritionist to help make sure that they're getting the calories that they need and the foods that they like, and really impact the quality of life positively in that way.
Wow, so much to think about. Thank you.
It is a lot.
So when you have a client that first comes in, I suppose it depends on why they're coming in, but what can they expect from their first therapy session?
So for their first therapy session, they can expect their initial assessment. And so like you said, depending on the age or concern, things will be slightly different. And so really what we do is we start with like our interview. And so, you know, if it's an adult, then, you know, we're asking them all the questions. If it's a child, then it's like parent or caregiver that are answering our questions. And like they said, you know, as we take a holistic approach, we're, you know, asking, you know, general questions to kind of like pinpoint where their concerns are, you know, talking about their concerns, you know, how does their impairment affect their quality of life, because that's really a big thing, their goals for being in speech therapy. You know, we want to make sure that, you know, we're providing them with the information about the concerns that they have, And so we use like a variety of assessment tools, so informal observation, standardized assessments, that's sort of what's to be expected. And then from the information that we gather from the assessments, the observation, information provided by parent or patient, we come up with a plan of care. We create their goals and that sort of thing. We'll schedule their next appointment, so their like first therapy session, and then within their first therapy session itself, we're looking at those goals that we've determined and continuing to build that rapport and that relationship with our patients. And yeah, that's kind of what is to be expected.
And I suppose a lot of it is really about managing expectations as well.
Yes.
Right? So, this happens across sort of all sectors, but you don't want someone coming in thinking that after 2 sessions they're going to be cured of whatever speech issue they may have, and they're going to be back to where they were. Like if they were a stroke victim, for example, or children, it might take a little bit longer depending on the sort of specifics for that particular child to see some real meaningful results, right?
Yeah.
And there's also expectations on the back end as well, because I think a lot of times people utilize, online tools, and they'll say, oh, well, I saw I should be doing X, Y, Z, from something I saw online. So a lot of times I think one of the things, it's funny, sorry, I'm diverting a little bit, but like one of the things, like I've had people come to me and say, hey Faith, like we're getting services elsewhere and we're happy, but I just want a second opinion because I know that you're going to be honest. And I think that speaks volumes, that like when patients come here, very often what they say is, I know that your clinicians are going to be honest. And I think, I think it's one of the worst things a clinician can do is not be real with their patients about what to expect. If you're 7 years post-stroke and you're coming and you're saying, hey, I want to talk again, and you have not talked in 7 years, that may not be a realistic goal. But what may be realistic is maybe we can work on some compensatory strategies. Maybe we can help you get an app on your phone, or work on typing, or work on a picture communication system that will allow you to communicate, but maybe that talking goal might not be real for you based on that diagnosis. And that can be a very hard conversation to have, because sometimes doctors don't even do that with patients. And so so it's managing expectations across multiple ends of the spectrum.
I think it's the same also for children. Like when we do have that kind of like developmental norms and milestones that we are looking at, but every child develops differently, and if there's a specific diagnosis that's happening, and if there's a certain kind of characteristics that's typical of that diagnosis, a goal might not be achievable or measure, like you can't attain that one. So it's really measuring, it's managing parents' expectations while providing them with that support, because I think it can be so tricky as a parent to know that your child isn't developing as they should, or kind of like making those comparisons with other children, and then knowing that, okay, you've sought the therapy, you're doing the therapy sessions now, how long will this take? When will my child talk? Sort of thing. And I think, yes, speech is important, being able to verbally speak, but part of speech therapy as well is like augmentative and alternative communication. So just because they're not speaking using their vocal language, they might be able to use an iPad fitted with a speech generating app or a speech generating device. Maybe they can learn sign language, and those are all forms of communication that we honor, because that's them being able to use their voice. And it's just kind of like providing, I think, education, because that area isn't as well known, but it is very relevant.
Because I think a lot of times families will come in and be like, the more the better, the more the more, and it's like, actually research actually shows more is not better. Research shows that 3 12-week consistent blocks with parent training per year yields the same amount of results as you coming multiple times every single week for a year. So I think what research shows is that quality is better than quantity. And so that's one of the things that we really educate our parents and really break it down, like, hey, if there's a cognitive impairment on top of your autism, or if we're looking at complex comorbidities, like we want you to really understand what it is, because like you can't therapize neurodiversity out of your child. That's who your child is, and there's a grieving process,
Right.
But here's what we can do, and let's look at your child's strengths and let's operate on those strengths. And we're not limiting the child by any means, but we also have to be realistic with parents that, hey, even if we did therapy every single day, your child might still be autistic, and if it goes away, they probably weren't autistic,
Right.
So
Yes. So it's a lot of educating of the community and parents and people in general.
Yeah.
The discipline of speech and language therapy has come a long way. Faith, you've been here. You said 16 years now at the HSA. I can't believe it's been that long. Let's talk a little bit about what that journey has been like, both here specifically at the Health Services Authority as well as just in the Cayman Islands.
Yeah. Oh, wow. Darn it. I think, we've gone from being underserved to, I would say there's an element of being maybe even overserved, not necessarily here at HSA, but I think on island.
Yes.
So, I think when you look at our population, I think, we have a lot of speech therapists for a jurisdiction this small. But, I think it's, for the most part, I think it's grown in a positive way. I think, we've gone from, I think when I first came back home, having to go and sit with doctors and explain what is a speech therapist and what do I do, and and it's going to the ENTs, going to the pediatricians, going to and even just, I think, the buy-in, I think, from our community. I trained in Florida, and when I first came home, if you needed a speech eval and you couldn't get into the one private therapist that was working, and you didn't go to government school, you had to go away.
Wow.
And so it was interesting, even when the service was offered, people just being but I still want to go to Miami. I still need the people from Miami. And it's so funny because actually there's been several times when somebody I graduated from college with treated a Cayman patient overseas and was Faith was the best. She was speech therapy student of the year. I'm going to refer you. And they would come back and they'd be the people in Miami know you by name, And so that part, and even now, I'll have patients that come that maybe are doing cancer treatments, and they'll say, oh yeah, person in Miami, highly recommend, and I have no clue who the person is.
Yes.
But I think definitely, I think we've grown in a positive way. I think that people now have a better understanding of the impact that speech therapy can have on their quality of life. And I think people are just more informed about the field of speech therapy and able to do a better job of advocating for themselves when they think that they need speech therapy. And I think what was really rewarding for me was earlier this year when HSA did their JCI certification, because what a lot of people think, I think a lot of people take for granted the breadth and depth of medical services that are available in Cayman when we look at our population.
Yes.
And and I can say that particularly even for our region, because I do a lot of volunteer work with my associations with CRIBSHA. And so, when the JCI inspector came to this department to do their inspecting, and they were oh, you have speech therapy? They were okay. And they honed in on speech therapy, and I was oh my gosh.
Yes.
And so, but the reason being is that most of the international hospitals that they go to certify do not have speech therapy.
Wow.
Right? And so that in itself was a rarity. And so the fact that when they went back and every morning they would give their feedback, and they went back and they were you need to give the speech therapy team time to write research and post, because so many of these small hospitals around the world could learn from your team. And they went in, they wanted to know what types of patients we saw, were they making progress? They pulled the notes. They were your autistic children make progress? I'm yeah. And she's show me. And I'm okay, sure.
Wow.
And so, and they looked at you know, they pulled babies, they pulled toddlers,
Yes.
they pulled adolescents, they pulled adults. They looked at the trainings that we do, the handouts that we give our patients, and she was like, what could I say but excellent? And, you know, to get that validation from an impartial, like, international body that goes to hospitals all over the world to do accreditation, and the fact that they, like, held up our section, like, in such high regard, I think to me was such a validating experience, because, you know, as a Caymanian, I just want to make a better impact on my community, and that's why I went into the field, you know, and it's like, I'm not doing it for the money, I'm not doing it for accolades, I'm doing it because I want to make the impact that my grandparents had on the community, you know. I want to say that, you know, and I'm seeing that now, you know, where I'm seeing my first sets of babies, now adults, and I see them in the supermarket, and they're like, hey, Miss Faith, I'm married now, or this or that, you know, and it's like, I feel old, but I'm so happy, you know. So it's like, but that's really what it's about, and you know, it's just so rewarding to see, you know, how the field of speech therapy has grown organically, and like our summer mentorship programs and stuff, how that has expanded. I mean, Janelle was a summer mentor with us.
Oh wow!
And we have like two, I think two. Studying, 2 more Caymanians studying in the UK right now, studying speech in the UK right now, who have come and done summers with us. And we're like keeping tabs on them, and we're like, hey, message us if you need help, you know, if you want to look at something. So I think what is rewarding for me as well is seeing the growth of Caymanians in this very specialized
because you were the
field.
First.
I was not the first Caymanian. Miss Vinette Glidden and Miss Claudette Webb were the first, but they don't actively do speech anymore. But I am the first medical speech therapist.
Wow.
So they were in the schools.
And to see it grow, you know, your team has grown, the profession has grown. It's just amazing.
Yeah, and I think it just shows that, like, regardless of the field, we have like talent. I think we just need to expose our young people to rewarding careers and, you know, offer that mentorship. You know, I don't look at any of these women as a threat to me. I look at them like, I'm ready to hand on the baton to you all, you know, and everything, like, literally, they're like, do you know? I'm like, here's what I have, you know, like, so I think, like, just that mentorship is something that is so key, and I think that is something that is, I think with as a team, our dynamic, I think it just helps to make it, I don't know, you guys tell me about that.
I mean, like, I feel like I was a byproduct of HSA. I did a summer internship here before I did my master's, and I actually did my pediatric clinical rotation placement for my master's here at HSA. So to be able to do an accredited university clinical placement at HSA just shows the quality. It shows just how good it is. I don't have any other word to say than that. But I think there is an emphasis on Caymanian people and mentoring the Caymanian people and being able to support the people that look like us, the people that speak like us, because for a lot of our children specifically, because I work with children, they don't have that, and we're grateful that there are so many in our profession now that are able to provide that support, because support is better than no support.
Absolutely.
But I think being culturally responsive is so important because we are such a culturally diverse country, and so we have to provide. We have to sit back as a professional and think about, okay, what kind of service do I want to provide to the patient that I'm serving? Because you're serving them, you're helping them to achieve language, helping them to achieve their communication. And the worst thing that I think can happen is for you to sit and be as the professional trying to be beneficial to the child's development whilst also reducing who they are as a person by ignoring their culture or the way that they speak, or because our TH sounds are D's and something as simple like that, you know, like that's not, we look at that and that's culturally appropriate. We're not going to work on TH. Your mother will talk with a TH, you know?
And you know what? I'm so glad that you've mentioned that, because even as you were sort of explaining and going a little bit more in depth about that, I was thinking Caymanian children when they see Caymanians in certain professions, like I get it all the time as part of media, because they think, oh, you're the only real Caymanian face in media. So like if I go to John Gray High School, the response that I get from those kids
like them.
is like, they make me feel like a superstar, because they're like, oh my God, the Sandy's here.
As a child, to see somebody
that looks like you, sounds
speaks
like you,
and
yeah.
is affirming who you are as a person.
Yes.
That is so important,
It's
just
so
for the
validating.
identity of our children.
Yeah.
Yeah.
I mean, I work. Oh, sorry, you were gonna say something.
And that's another thing too, like we want to address that like language differences or like dialect is not disorder.
Yes.
So, you know, no one can tell you that just because you say this one sound differently, there's something wrong, you know? And that's a big thing in like educating people to know that like language dialects are not disordered. And so that's not something that you should come here to have to like fix, you know? Really, one thing that we kind of like work on is that maybe it has an impact on their spelling, but you know, that's not always the case, you know? And so that's really important for them to know that.
Yeah. Or even the grammar differences too. You know, even though it sounds very different, a lot of Caribbean, the English-speaking Caribbean, like Creoles and dialects, share a lot of the grammatical features of African American vernacular English, even though they sound very different. And when you look at the history of the grammar, a lot of that is influenced by African grammar, African sort of colloquialisms, the way that they do things, you know, so even just repeating words, like when they'll be like, yeah, instead of saying huge, a child might say, yeah, that was big, you know, like that's something that in the Yoruba language they do. If it's something that is like they want to emphasize, they'll say the word twice, you know, and so it's like all of those little nuances that you know we recognize that, hey, and we'll and that's where the informal assessments come in, where we're testing to see, hey, like, okay, maybe in your communication you're using your dialect. Is it affecting how you're reading? Is it affecting like your quality of life in that? And if it's not, there's no need for us to work on it clinically. And in fact, it's actually considered unethical clinical behavior by clinical standards, both in the US and the UK.
But when we also talk about how speech therapy has grown, looking more at the other side of it, right? That can sometimes be the negative side of it, right? Where, you know, everyone kind of knows what we offer. They want to get the therapy every day, but then it's like forgetting, who are you really? Let your child be a child as well, right? Go back to those parenting skills that you were raised, you know, go back to how you were fed as a child, you know, eating together as a family. Sometimes it's just the fundamentals that are missing, or the fundamentals that are missing to bring everything together. So looking at that side of it too, we find that the community is becoming really dependent on therapists to be able to fix their child or to fix this, fix that, when, you know, they're not taking a holistic approach from a family level, you know. So that's the other side of how things have grown in a more kind of, you know, negative light.
And I'm sure that goes back to what you were mentioning earlier, Faith, about just being honest. To say, this isn't something you actually need me for.
Exactly.
You know, I don't want to sit here and bill you for something you don't need me for.
Exactly.
This is part of our culture. This is family dynamics. You know, maybe here are some tips that you can work on.
Exactly.
Well, this has been such an amazing interview, ladies. So where can people find you? So let's make sure that we understand, you know, your services are available. Where are you located? And if they need to get assistance from the speech therapy team, who do they contact, and you know, how is that process?
So we're located in the Baytown Plaza. You know, it's across the street from the Wharf restaurant. That's kind of helpful for a point of reference. If they're looking for speech therapy services, we do require a referral from their doctor. So, you know, if it's a kid, then they want to go into their pediatrician and speak with them and get a referral for us. And then, you know, give us a call, email us to let us know that you would like to schedule your assessment, and then we will get you booked in as soon as possible, and then we'll go from there.
Okay. Sounds wonderful.
Our phone number, 244-7675, is our registration desk, or they can call 244-2730, and email speechtherapy@hsa.ky.
Okay, well, congratulations. You guys have come a long way. Faith, I remember when you were just part of the physio department and one little office. Now look at you guys. You've got this amazing room and offices and additional space, all for your entire team. So congrats to all of you ladies. Job well done.
Thank you.
Thank you.
For 20 years, we've committed to helping the people of the Cayman Islands live longer, healthier, and happier lives. But healthcare and the expectations of patients are rapidly evolving, and so must we. We have made incredible clinical and technological advancements and achieved JCI accreditation, the internationally recognized gold seal of approval for patient safety and quality of care. So it's time for our image to reflect our transformation from a local hospital to a world-class healthcare authority with a new logo that symbolizes national duty and pride, a statement that reinforces our commitment to our patients every step of the way, with colors as bold as our mission to provide the highest quality healthcare. Dynamic, professional, skilled, committed, caring. This is HSA.